Hello, my name is Garrett O'Donoghue and I'm the Registrant and Customer Relations Manager at PSI. During late 2019 and early 2020, a number of Code of Conduct information events were held around the country. At each of these information events, there was a guest speaker who looked at a specific principle of the code from their own unique perspective. The following slides provide a summary of each presentation given. Where permission was provided by the speaker, the corresponding slides from these presentations are also available on the PSI website. The guest speaker for Principle 1, Put the Patient First, was Niall Byrne. Niall is the Registrar of the PSI. Niall spoke about the importance of care and professionalism. The Code of Conduct supports pharmacists to provide safe and consistent care to patients. Each indicator listed under the principle further detail what putting the patient first looks like in practice with no moral ambiguity. Niall highlighted that in practice, healthcare is very complex. The code also poses various questions to the profession such as, do I always put the patient first? And how do I know I'm doing the right thing? There are all kinds of pressures such as times and deadlines, and the code can help as a guidance through this moral maze. Niall explained that according to virtue ethics, the good person exhibits certain traits as well as having requisite knowledge and acting in certain ways. Using this perspective when facing a dilemma, a pharmacist should ask, what would a good pharmacist do? The public expects that a good pharmacist will practice to the full extent of their competence. They will always exercise careful and considered professional judgment and accept that accountability is part of what it is to be a professional. Pharmacists must be aware that professional dilemmas are to be expected and when making a decision, be able to show afterwards how they reached this using their professional judgment. The topic of care was examined in more detail, looking at care as a virtue and the ethics of care. Niall concluded by reminding us that always putting the patient first means never betraying the trust that the individual places on a pharmacist as a healthcare professional. The guest speaker for Principle 2, Acts Professionally, was Aisling Reast. Aisling is the Registrar at Hibernia College. Aisling spoke about her experience of professionalism throughout her career. Her first experience of a code of conduct came when she was a pharmacy student. On the first day of college, her class was shown the code of conduct for students, and from that moment she realised the high standard that pharmacists are held to and how being a pharmacist instills trust by other people in you. Her first experience of the high level of professionalism displayed by pharmacists was during her secondary school work experience in a community pharmacy. She was inspired by the demonstration of patient-centred care by the pharmacists and their going above and beyond the call of duty even when the patient didn't see it. At this point, she realised the difference between a job and a profession. During early years practising as a pharmacist, she valued the time when she worked with other pharmacists. These experiences allowed her to learn from them as they demonstrated professionalism with colleagues, staff and patients, and how they worked through difficult situations. As Aisling's career path changed, she constantly encountered the professionalism of her colleagues as they helped, mentored and supported her and worked together to help and improve the profession and spread knowledge. As part of Aisling's role working in the Irish Institute of Pharmacy, developing the CPD system, she witnessed pharmacists again demonstrate high levels of professional practice, integrity and upholding standards through their engagement with the project. When working in Appel, pharmacy students were able to describe how they witnessed professionalism being displayed daily by pharmacists, demonstrating integrity and making professional decisions to act in the patient's best interest. To sum up what the principle means for pharmacists, Aisling shared a quote from David Meister. Professional is not a label you give yourself, it's a description you hope others will apply to you. There were two information events held examining Principle 3, Communicate Effectively. The first was by Aoife Mellet, who is the Manager of Legal Affairs in the PSI. Aoife looked at how poor communication can sometimes lead to patients contacting the regulator. Good communication is key to any interaction, not just with patients, but also with other healthcare professionals and between members of the pharmacy team. Looking at some of the major causes of complaints in healthcare, Aoife highlighted that they aren't always because of catastrophic failures in care. They're because of failures in communication. Good communication helps patients feel at ease. It's common for people who need healthcare services to feel anxious about their health. Having good communication will reduce their anxiety and make them feel comfortable. Aoife also discussed how communication is about much more than the words that are said. The tone of voice, the attention given to what other people are saying by listening to them, and the messages given out by body movement and position are also key elements of good communication. Aoife also looked at two extracts from the Preliminary Proceedings Committee, the PPC, annual report from 2017 to 2018, where observations were made in response to a number of complaints received about poor communication by pharmacists. In conclusion, Aoife summarised that communication is key to the role of a pharmacist. Patients want to be treated in a transparent manner and with dignity, and effective communication will ensure patients receive safe and appropriate care and may avoid escalation of issues to the regulator. The second presentation on Principle 3, Communicate Effectively, was given by Dr. Conor McChrystal, who is a community pharmacist and has acted as a PSI expert witness on a number of occasions for fitness practice inquiries. Conor began by highlighting that communication plays a key role in the core competency framework for the pharmacists and is assessed as part of the practice review for pharmacists CPD. Conor went on to explain the role of the Preliminary Proceedings Committee when the PSI receive a complaint about the pharmacist or pharmacy, and look at the instance of complaints involving communication issues that have been reported over the last number of years, and some examples. Conor then went on to look at each part of Principle 3 in more detail and how pharmacists could meet these requirements. He emphasised that when speaking with patients about their medicines and lifestyle choices, clear, confident communication is a key, and that communicating in a discreet manner will often prevent issues arising that may lead to a complaint. He also reminded us that all staff should be aware of the importance of confidentiality when dealing with patients. Conor concluded with two key learnings for pharmacists. A complaints procedure should be in place in every pharmacy, and all pharmacists and members of staff should be trained on how to handle a situation whereby a patient raises a concern or wishes to complain. Pharmacists and other members of staff should be mindful of how they interact with patients, especially about sensitive or personal issues. Where at all possible, the patient should be given the option of using the consultation area to discuss health matters or concerns in private. The guest speaker for Principle 4, Work with Others, was Dervla Kelly. Dervla works in the University of Limerick as lecturer in medical education and also part-time in community pharmacy. Dervla explained that working with others is a key part of being a pharmacist. In delivering healthcare, effective teamwork can immediately and positively affect patient safety and outcomes. The need for effective teamwork is increasing due to increasing comorbidities and increasing complexity of specialisation of care needed for patients. Dervla highlighted that when we think of working with others, a lot of people will think of multidisciplinary teams that are in hospitals. However, a pharmacist working in a community pharmacy must work in partnership with local doctors and other healthcare professionals to ensure the best outcome is achieved for patients. Working with others also encompasses working with the patient to help them make suitable healthcare decisions and, when necessary, referring them to another healthcare professional whose expertise can best help the patient. Dervla explained that her role as a lecturer involves working closely with senior clinicians, clinical academics, students and patients in the development of teaching methods and to collaborate on research projects. She also explained the pharmacist's role in medical school and highlighted that the curriculum has been changed in medical schools to focus on preparation for practical prescribing, including a prescribing safety assessment which is taken by graduating medical students in the UK and Ireland to demonstrate competency in prescribing practice and competencies in relation to the safe and effective use of medicines. Dervla went on to explain the different roles that a pharmacist can have in conducting research and some of the research streams that she is currently involved with. Dervla finished by highlighting the value of research to improve patient care, to provide leadership opportunity and work within a professional network, and also to make her a better pharmacist by exposing her to the latest ideas and evidence about patient care and drug delivery. The guest speaker for Principle 5, Show Leadership, was Caitriona Gowning. Caitriona works as a hospital pharmacist. Caitriona looked at how the pharmacy in the hospital took on a leadership role to ensure the safe, effective, evidence-based and economic use of drugs and other therapeutic substances. One example of their work was where they identified high-risk medication, that is, medications that have a heightened risk of causing significant patient harm when they're used in error, and how they enforced specific storage and process requirements to reduce the likelihood of harm occurring to a patient. Measures put in place included the use of additional labelling and extra ordering requirements from the wards. A mobile app was created so everybody could have access to this information. The app also included other medication safety information, such as sound-alike, look-alike drugs examples. Caitriona discussed how there is now widespread recognition that effective leadership by healthcare professionals is essential in modern healthcare settings. The types of leadership will vary depending on the role of the pharmacist, from being a superintendent in a chain of pharmacies, working in a hospital with a team, or working as a locum pharmacist with a new team every day. Caitriona concluded that no matter what position a pharmacist holds, it is vital to lead by example to help promote and continuously improve the delivery of high-quality healthcare to patients. The guest speaker for Principle 6, Maintain Competence, was Michelle Scott. Michelle recently commenced a new role as Simulation Manager at the Royal College of Surgeons in Ireland. The Clinical Simulation Facility in RCSI allows both professionals and students who want to learn, develop or practice the latest surgical techniques within the centre's fully functioning operating theatre, control room and debrief room. This training centre is designed to give an immersive, realistic and emotionally rich experience mirroring the real world. Michelle qualified as a pharmacist and has worked in various pharmacy roles. She previously worked with the Irish Institute of Pharmacy, where she led the practice review pilot process from concept to inception as it is today. All these roles involve working with other pharmacists and healthcare professionals, particularly when it involves making a difference and having an impact on patient care and safety. This provides opportunity for pharmacists to continue to develop their knowledge throughout their career, whatever their role is. Michelle concluded that lifelong learning is essential for the pharmacy profession. There is no doubt about it, healthcare is a rapidly expanding field and it is important to stay up to date on the latest in patient care and applying this knowledge to ensure safe and effective care for the patient, whatever your role. The guest speaker for Principle 7, Be Open and Honest, was Angela Tysall. Angela is the National Lead for Open Disclosure in the HSE Quality Improvement Team. Angela talked about the importance of open disclosure following a safety patient incident and also the requirements of the revised HSE policy on open disclosure. Open disclosure is defined as an open, consistent, compassionate and timely approach to communicating with patients and, where appropriate, their relevant person, following patient safety incidents. It includes expressing regret for what has happened, keeping the patient informed and providing reassurance in relation to ongoing care and treatment, learning and the steps being taken by the health service provider to try to prevent a recurrence of the incident. Angela acknowledged that errors in pharmacy happen and that every pharmacist must be open and honest with patients when something that goes wrong with their treatment or care causes or has the potential to cause harm or distress. Reviewing and learning from mistakes leads to safer, better systems, quality improvement and improved patient safety. It is the professional, ethical and human response to patients involved in or affected by patient safety incidents and is what patients want and expect. Angela also discussed the 10 main principles behind open disclosure, looking at all the steps from the acknowledgement right through to continuity of care for the patient. To assist pharmacists with managing open disclosure in practice, Angela also explained the ASSIST model of communication. To explain the impact of poor open disclosure on patients, Byrne O'Reilly discussed her story and the importance of transparency in healthcare. Byrne O'Reilly is chairperson of Patients for Patient Safety Ireland, a World Health Organization initiative which gives patients and their families an opportunity to share experience with healthcare professionals and policymakers.